This afternoon, the Indiana Health Department released a list of what it's doing. It includes regular communication with the CDC, creating a hotline to answer questions, developing a training video for healthcare workers, and creating a questionnaire for healthcare workers as well, and talking to the State Department of Education on how to prepare school nurses. And despite all the criticism, experts are saying there is no need for people here to panic. WSBT's Kelli Stopczynski talked with local health leaders today. And Kelli, the main concern about the second nurse who was infected is she was on a plane when she had a fever.
And Rick, she contacted the Centers for Disease Control and was told her 99.5-degree fever did not meet their threshold for being contagious, and they told her it was okay to fly. The CDC is now, though, contacting everyone who was on that flight. But St. Joseph County's health department says the risk of you or me contracting the virus is still extremely low.
We're all taking this as a very serious risk, no matter how low we feel it might be.
Janessa Doolittle is an epidemiologist and emergency preparedness supervisor at St. Joseph County's health department. She says she understands why the public is frustrated about changing information from the CDC.
I think that this is a learning experience for everybody. We've never had Ebola in the United States before. Unfortunately, mistakes have been made, and hopefully the world and the CDC have learned from them, and moving forward, they won't be mistakes that are made again.
The World Health Organization says Ebola spreads through direct contact with bodily fluids of other people. Doolittle says it can be in coughs and sneezes in the same way influenza spreads, in droplets.
So if I sneeze and you inhale my sneeze, can you get Ebola if I have it?
There is the potential there if I inhale your droplets, yes. But if I breathe the same air that you breathe, no.
I think oftentimes with anxiety, it's generated substantially so when we have the unknown. And then you have a worst case scenario that exists.
Indiana's Psychological Association says this is not the first time an illness or unknown has caused widespread concern. Dr. Carrie Cadwell points to bird flu and anthrax scares. But she says the most important thing you can do is know the facts.
The general public, when anxiety is escalating, they generally tend to not necessarily be focused on the facts as much as the anxiety of how should I be protecting myself? What does this mean for me?
Doolittle says local hospitals and first responders are preparing for Ebola, but she also says we should be more worried right now about the flu. Last year, 7,000 people in the United States were hospitalized with influenza. 6 people in St. Joseph County died from the flu, and some of them were relatively young.
But we've been receiving phone calls, even emails here to the station, people wondering how local hospitals, what they're doing to prepare for this, though.
Those viewers want to see that. That's what they're saying. And I contacted Memorial, St. Joseph Regional Medical Center, Elkhart General, and IU Health in Goshen, asking to do that. Can our cameras come in, watch somebody suit up, show us what you have to go through? Memorial and Elkhart General said they would do interviews with us, but they can't show us anything. They're all right now directing questions about the protocols to the State Health Department. We just got a release a few minutes ago saying that. So we tried, but we're not going to be able to show you that, at least not right now.
Yeah. All right, Kelli, thanks very much.